Well, eligibility can differ slightly depending on where you are and your health situation. Some places, like Manitoba's guidelines we saw, mention specific groups like people with HIV who are otherwise healthy, young men in correctional facilities, people with certain immune issues, up to certain ages.
Right.
But general contraindications, reasons not to get it, would include being younger than 9 years old.
Hmm.
Also, pregnancy. If someone is pregnant, they're usually advised to wait until after the pregnancy.
Okay. But breastfeeding is okay.
Breastfeeding is generally considered fine, yes.
Right.
The main thing is if someone has had a severe allergic reaction like anaphylaxis to a previous dose of the HPV vaccine or any of its components, that's a reason to definitely talk to your doctor first.
Makes sense. And you mentioned one vaccine wasn't for males.
Right. Cervarix, the bivalent one targeting just 16 and 18, wasn't licensed for use in males,
No.
at least based on the sources we had from around 2016. Gardasil and Gardasil 9 are used in males.
Okay. Crucially, though, even if someone is vaccinated, they still need their regular cancer screenings like pap tests.
Absolutely, 100%. Vaccination is a fantastic tool, but it's not a replacement for screening.
Why is that?
Well, a couple of reasons. First, the vaccines, even Gardasil 9, don't cover every single high-risk HPV type that could potentially cause cancer. There's still a few others out there.
Ah.
And second, screening can pick up precancerous changes early, even if caused by a type someone was vaccinated against, perhaps if the vaccination wasn't fully effective for some reason, or if they were exposed before vaccination. So screening is still vital.
Right. Vaccination and screening work together. Okay, let's move into an area that, well, often generates discussion. Vaccine safety. What's the general scientific consensus on HPV vaccine safety?
So when you look at large reviews, like the one from PMC we consulted, they generally conclude that the benefits of HPV vaccination preventing really serious diseases strongly outweigh the risks of side effects.
Okay.
And most side effects that are reported are mild, things like soreness at the injection site, maybe a mild fever, similar to what you see with lots of other vaccines.
Pretty standard stuff.
Yeah. However, it's also true, and important to acknowledge, that concerns have been raised over the years, and researchers continue to monitor safety very closely. The PNC review did note that a lot of the safety data comes from within the vaccine market itself, and they suggested more independent monitoring could be valuable.
Okay, so acknowledging that context, what kinds of specific concerns have people brought up?
There have been various things. For instance, one report mentioned post-mortem findings suggesting maybe vaccine components could cross the blood-brain barrier, potentially linked to inflammation, but they couldn't definitively say the vaccine caused it.
Okay. Correlation versus causation kind of thing.
Exactly. There have also been ongoing discussions about ingredients like the aluminum adjuvant used in many vaccines. Some animal studies raise questions about potential effects with repeated doses, but translating that directly to humans is complex.
Right. Aluminum is in lots of vaccines, isn't it?
It is, yeah, it helps boost the immune response. Other concerns included suggestions that maybe certain conditions weren't being reported adequately, or reports suggesting a possible link in very rare cases between vaccination and certain complex syndromes, though again, proving a direct link is very difficult.
So quite a few specific questions or hypotheses have been looked at. What about the big picture from, say, the World Health Organization? They review this stuff globally, right?
And you do. The WHO report we looked at synthesized data from tons of studies involving like over 77,000 people in randomized trials alone.
Wow, that's a lot of data.
It is. One challenge they noted was that the definition of a serious adverse event, or SAE, wasn't always consistent across trials. So the reported rates varied a lot, sometimes from less than 1% up to 25% in certain comparisons.
That makes it hard to compare directly.
Right. It meant they had to be cautious about the certainty of the evidence, even with large trials. But crucially, when SAEs were reported and investigated, most were found not to be related to the vaccine.
Okay.
Deaths were reported in some trials, as can happen in any large group over time, but again, when causality was assessed, no link to the HPV vaccine was found.
What about things like autoimmune diseases? That often comes up with vaccines.
Yeah, the WHO looked closely at that. When they pooled data for autoimmune diseases for Cervarix, they found no significant difference compared to the control groups.
Okay.
And large observational studies, looking at real-world data, also generally haven't found a link between HPV vaccination and conditions like multiple sclerosis, other demyelinating diseases, blood clots, or migraines. They rated that evidence as moderate quality.
So generally reassuring on those fronts.
Yes. There was one study that flagged a possible increased risk of appendicitis, but the suspicion was that it might have been due to a change in medical coding rather than a real effect. The one thing consistently confirmed as a rare but real vaccine-related serious event is anaphylaxis, severe allergic reaction.
Which can happen with any vaccine or even foods.
Exactly. And the rate seems very low for HPV vaccines, something like 1.7 cases per million doses in one study.
Okay, so summing up the safety part. While specific concerns exist and are monitored, the large-scale reviews from bodies like the WHO conclude serious adverse events are rare and the benefit-risk balance is favorable.
That's a fair summary of the overall findings, yes.
Great. Now let's specifically talk about HPV and men. We often hear about vaccination for girls, but what's the story for boys and men?
This is really important and something that gained focus. The NI article we saw really hammered this home, the need for male vaccination because of the rise in oropharyngeal cancers, those mouth and throat ones.
Right, you mentioned HPV-16 being a huge factor there.
Exactly. Almost 90% of HPV-positive oropharyngeal cancers are linked to HPV-16. And remember, HPV also causes penile cancer, anal cancer, and genital warts in men, too. It's not just about cervical cancer prevention in women anymore.
So vaccinating boys and men offers them direct protection from potentially serious diseases.
Absolutely. It protects them from those cancers and warts, and of course it also helps reduce the overall circulation of the virus in the population.
Herd immunity.
Yeah, contributing to herd immunity,
Yeah.
which indirectly protects everyone, so it's a win-win.
Is testing for HPV in men done routinely, like cervical screening for women?
Not really, no. There isn't a standard, widely recommended screening test for HPV in men like the PAP test or HPV test for cervical screening in women.
Hmm.
If a man develops an HPV-related condition like warts or cancer, then it's diagnosed and treated clinically. But routine screening isn't common practice. The focus for men is much more on prevention through vaccination and understanding that, again, most infections clear up naturally.
Okay, so prevention is key. Let's just quickly recap transmission and other prevention tips besides the vaccine.
Sure, so we said skin-to-skin contact during sex is the main route. Condoms can definitely help reduce the risk.
But not eliminate it completely?
Right, because HPV can infect areas the condom doesn't cover, so they reduce risk but aren't foolproof. Also, interesting point, regular hand sanitizers and disinfectants don't really kill HPV effectively.
Oh, really?
Yeah, it's quite a hardy virus. It can survive on surfaces for a while. So that point about potentially sharing contaminated personal items like razors might be relevant there.
Good to know.
And in medical settings, obviously, proper cleaning of equipment like ultrasound probes is super important to prevent any accidental spread.
Okay. So sexual contact is primary, but be mindful of shared items too. All right, let's try and wrap this up. If you had to boil down the most crucial takeaways for our listeners about HPV and the vaccines, what would they be?
Okay, I'd say 1, HPV is incredibly common. Most people encounter it. 2, while most infections clear, some persistent ones can cause serious problems, including several types of cancer and warts.
Right.
3, the vaccines are a really powerful tool for preventing these problems, targeting the riskiest HPV types. 4, major health organizations, after reviewing tons of data, consider the vaccine safe with rare serious side effects.
And beneficial for both guys and girls.
Absolutely. Vaccination helps protect both females and males directly from HPV-related diseases.
And if someone listening still has questions or wants advice specific to them,
Definitely talk to a healthcare provider. That's the best way to get personalized advice based on your health history, age, and what the specific recommendations are where you live for both vaccination and screening.
perfect. So, a final thought to leave everyone with. Considering everything we've learned about how widespread HPV is, the different cancers it's linked to, and also the ongoing work monitoring vaccine safety, what other questions pop into your mind about how we tackle this from a public health perspective? Maybe around, who gets vaccinated and when, or making it more accessible.
Yeah, exactly.
Well,
How do we optimize those strategies?
something to think about. We definitely encourage you to check out the sources if you want to dig deeper. Thanks for joining us on this deep dive.